Here we are looking at a cow's heart, and we can see that there is the base that is formed mainly by the left atrium, but to a small extent by the posterior part of the right atrium. It is directed backward and to the right and is separated from the vertebral column by the esophagus and aorta. Now we see the apex that is located in a posterior and lateral location relative to the right ventricle. With right ventricle, it forms an apex of the heart. The function is to pump oxygen blood from lungs to the body. Now we see the coronary sulcus that we can see that is like a spin around the heart. And the structure contains the trunks of the nutrient vessels of the heart and is deficient in front, where it is crossed by the root of the pulmonary trunk on the posterior surface of the heart. The coronary sulcus contain the coronary sinus. Here we can see the coronary sulcus. This is a separation that divides the ventricles, the right ventricle and the left ventricle. Here we have the collapsed superior vena cava, which returns the oxygenated blood from the body. And here we can see the right atrium.
So first in this heart we can see the right ventricle, which pumps oxygen into our blood. Then we have the right atrium and the auricle. The atrium is basically a receiver for a lot of blood, and then the auricle just pumps it out of the heart. Then we have the tricuspid valve, which, as the name indicates, it basically just modulates the flow of blood through leaflets, and then you can see here a closer look at it. So in here you can see the chordae tendae, which are collagen cords. They're quite easy to spot. And then we have the papillar muscles, and right underneath them the pectinate, which both help in the contractions that the heart makes. Firstly, the pulmonary trunk, which basically just deoxygenizes blood that goes then to the ventricle. It's one of the major arteries. And then we have the semilunar valve, which basically takes blood into the arteries. So, firstly, we have the intraventricular septum, which is the separation between the two sides of the heart, the two chambers. Then we have the myocardium and the endocardium, which are both muscle tissue. The myocardium serves as the middle part, and then the endocardium serves as the innermost layer. Then we have the venae cavae, which divides into superior and inferior. It's this tube that is not present in the heart I'm presenting, but of course it was there at some point, and the superior part goes to the head, and then the inferior part goes to the rest of our body, like our feet or our pelvic cavity. Finally, the coronary sinus just drains the deoxygenized blood that goes to the myocardium.
Okay, so for the left part, blood will come from the lungs into the left atrium to then pass through the biscuit valve to get down into the left ventricle. Here, it will contract and push the blood aggressively enough to cause the semilunar valves to open. When the pressure gets high enough, the blood will travel to the aorta and then into the rest of the body. And here we can find the left auricle.